outstanding contribution in the field of forensic science and investigative sciences at international level by the International Association of Police Academies, that is Interpa, Turkey, on 11th February 2019. One more is the Humanitarian Forensic Award in recognition of the exceptional service in the field of humanitarian forensics by International Center for Humanitarian Forensic, ICHF, on September 5, 2019. Some notable national awards include President's Police Medal in 1997, Best Forensic Science Laboratory Director of the Country in 2004, Lifetime Achievement Award by the Metro University, Uttar Pradesh, and All India Institute of Medical Sciences, New Delhi in October 2008, and also the Bharat Mata Award by the Indian Institute of Oriental Heritage, which is received in 2014. Sir holds a large number of publications in various journals of national and international repute. We are really fortunate to have you, sir, here with us, and we are looking forward for your kind guidance and sharing your expertise with the youngsters in the field of forensic science and forensic toxicology. We welcome you, sir. We are honored to have you here, sir. Sir, please. Dear participants, within a few minutes, we are going to start our talk. Just be online.
Good afternoon, everyone. As you all know, this is world's first and the only forensic science university. And we have been conducting this kind of webinars in this critical time. And this is the fourth webinar in the series. This time we have selected the topic of toxicology. You can call it even a forensic toxicology, which is a very old subject. I still remember when there was no forensic laboratory, there used to be chemical analyzers laboratory. And chemical analyzers laboratory will have the main subject or the main department, and that used to be toxicology. I still remember the days where doctors used to head toxicology divisions in some of the states. Even in Gujarat, we had Dr. Roy, who was a doctor basically, and he was heading the chemical analyzers laboratory, and the main work was toxicology. So toxicology is a very old area, but it's very important and is a very challenging area. And as you know, if you take the definition of forensic science, it is application of various branches of science in detection and prosecution of crime. So various branches of science. So one of the branches is chemistry. And if you go deeper into chemistry, because that you call it a forensic chemistry, if you go in further details, it becomes toxicology, where you are applying your knowledge of chemistry and then creating an area of toxicology. So toxicology, normally we apply our knowledge of chemistry, because if you take the definition of toxicology, it is a science of poisons. We call it like this in a very short term, science of poisons. So science of poisons means it deals with poisons, the definition of poison, the types of poisons, the classifications of poison, the effect of poison, physiological effect of poisons, treatment of poisoning cases, investigation of poisonous cases. They're all inclusive of toxicology. So this is a science of poisons. Now when you deal with poison, poison is a chemical substance, though there are some microorganisms also which cause poisoning effects. But normally, if you take 95% of substances which we come across in toxicology, they belong to chemistry. So they are chemical substances. So therefore, this is an application of chemistry in investigation of crime. Now, coming back to definition of poison, there are a large number of definitions. If you see the book, any substance which causes bodily injuries or maybe death, that substance can be defined as poison. Now, here there is a problem. Any substance you take which causes injury to the body and causing death also can be defined as poison. Then I used to ask questions to students and many other officers who used to come for training as to, if suppose you take sodium chloride and it is 5 kilograms of sodium chloride and the person dies, will you call or will you classify sodium chloride as a poisonous substance? And some of them by mistake used to say yes, because people are dying. And then I said, if you prepare a list of poisonous substances, would you put sodium chloride as poisonous substances? And then there is a confusion. No, sir, that cannot come. So there is some problem in the definition. So we have to use the word in a small quantity. When you take any chemical substance in a small quantity, which in small quantities is causing some injurious effect to the body or is causing death, that substance can only be called poison. Sodium chloride cannot be called poison because you have to take 5 kilograms of sodium chloride in order to kill someone. or in order to cause death. So this is how it is very important, small quantity. Don't forget while you define poison, small quantity. Here is you are dealing with a very small amount of material which is causing death or which is causing some injurious effect. So this is how we go for poisons. We classify poisons, and there are varieties of poisons. Now the person who handles toxicology, they are known as toxicologists. They are toxicologists. And if you check the responsibilities of toxicologists, in the forensic science laboratories, where you have biologists, your serologists, your DNA expert, your chemists, your physicists, your handwriting experts, your fingerprint experts. Amongst all this, the duty and responsibility of the toxicologist is the toughest. It is said. Because there are lakhs of poisons available in the market. And as I told you, the definition of poison itself is small quantity. So the person who consumes poison in a very, very small quantity, that goes into the body, and then depending on the body weight, gets equally distributed. And then the fellow dies. Now, you take out the organs in order to determine the cause of death as to what kind of poisonous substance the person has consumed, which was responsible for his or her death. Now, this material which you are taking will not be more than half kg. You may take, we call it viscera, you can take stomach, you can take intestine, liver, spleen, kidney, etc. Now, the total weight of this person is, say, for example, 50 kilogram. Now, this small quantity of poison, the fatal dose of which would be hardly 50 milligram or so, gets equally distributed into that 50 kg body weight. Now that 50 kg, that means 1 kilogram will contain 1 milligram. For example, that is a half kilogram material you are getting for determining the cause of death. So that half kilogram will have a half milligram, 500 microgram you can say. Now this 500 microgram again is not known to you. As a toxicologist, you don't know what kind of poison this fellow has consumed. And there are lakhs of poisons available. Now you apply some method of extraction, try to extract out the poison, and we have not come across any foolproof method so far of extraction where you are able to extract out 100% poison. So that 500 microgram of poison which is present in our tissues, blood, etc., is not possible to take out 100%. Yeah, it is done. It's done. We are here into toxicology. So now and then you are dealing with body tissues, etc. And many times the material you get for analysis is also deteriorated, decomposed. And then we apply your method of extraction. Many times this fatty material also come into it. So then you need to purify. That purification process is also very, very complicated. As a result, you also lose some of the poisons. That 500 microgram, ultimately when you get, it may be 350, 400 microgram maximum. But that also will contain some kind of impurity because you don't have a foolproof method of removing fatty material, etc., which is coming as a kind of impurity in this. So this impurity you cannot remove 100%. Some of the impurities will remain. you may apply some chromatographic methods for removing the impurity or separating your poison. There also you're losing some poison. And then the detection, you don't know what kind of this poison is. You need to detect. It could be insecticide, it could be barbiturate, it could be opium, it could be potassium cyanide. Nothing is known to you as a toxicologist. Now you are dealing with that 300 or 350 micrograms quantity, which is also having some kind of impurity. You have tried to remove the impurities using your chromatographic method. Normally you use column chromatography or maybe thin layer chromatography. And now this poison is subjected to its detection, identification, and you are also supposed to give a quantitative estimation. Now you can imagine, this is the job of a toxicologist. So this is in where you can define toxicology, the toughest area in forensic science. And therefore, you select a toxicologist who has got very good grip, a very accurate person, very, very sincere, very knowledgeable, has knowledge of all kinds of poisons. And then this fellow accurately extracts poison, and then systematically you need to analyze. For systematic analysis, there has been classification of poisons because you need to classify them. Otherwise, how can you start testing each and everything? Because one test you applied on that 300 or 350 microgram quantity of poison which you extracted out, you start with testing potassium cyanide, for example. You take some material, you are losing 10, 15, 20 microgram in that process, it is negative. You test opium, again it is negative. You test some other poison, it is negative. How can you go for testing 1 lakh of poisons from that 300 microgram quantity? It's not possible. So you need to classify them. And that classification is based on their chemical nature, and it is also based on physiological effect. There is a law relating to poison. And then I'll come to classifications. Now here, then based on their effects in the body, you classify them, you call them irritants. Irritants could be again classified further, inorganic, organic, and mechanical. So now you have to come out with a system. How do you handle inorganic poisons if it is there in my material, in my viscera, in my blood, whatever tissues have been given to me by investigating officer? It could be organic and it could be mechanical. So there are different procedures for extracting these 3 groups of poisons. This is how they have been classified. You go further. If it is suppose inorganic, these are the metals. The non-metallic compounds are there, which are poisonous. There are metals also, which are poisonous. So you have to again go into the details of it. So you normally go for a single test which is able to detect all your metallic compounds and sometimes even your non-metallic compounds. Single procedure. That is the need. That is a demand, need of the hour. So toxicologist has to design a method which a simple method you apply and it takes care of varieties of your poisons. Say for example, if this is the way, you normally apply ion exchange chromatography, which will take care of your negative radicals and even positive radicals. Your metallic compounds are detected, your non-metallic compounds are also detected, and you require a very, very small quantity of suspected poisonous material. So this is how you go. Vegetable poisons. I am not going into the details. It's a very, very wide area. And then if suppose I start discussing everything, it will take 5, 6, 10 hours. But I will discuss in brief. And normally I will deal with the challenges the toxicologist is facing. And then what are the advancements we have made in order to handle those challenges, which every toxicologist in the world is facing. The mechanical poisons, Then you have poisons which are affecting your cerebral part of the body, spinal part of the body, and even cardiac system, so cardiorespiratory. And then they have also been further classified: narcotics, intoxicants, deliriants, excitants, depressions, cardiac type of poisons, and asphyxiants. This is known, so I am not going into the details of it. Some of the pictures of these poisons. Then further, organic, inorganic. Again, we discussed metallic, non-metallic. And then in organic, again, you are classifying them into non-volatile and volatile. Because if you don't go for this classification, it is very likely that you may lose volatile poisons if they are there. If suppose somebody has consumed alcohol, somebody has consumed chloroform, somebody has consumed some kind of a petroleum material. Now, these are all volatile materials. Now, if you ignore this volatile portion and you look for only non-volatile thing, whether it is opium, whether it is insecticide, whether it is potassium cyanide, then also you may not get the poison, though it is there. So you start, normal practices, you start with volatile. So before they get evaporated, when you open the bottle containing your suspected material, before volatile poisons get evaporated, you need to catch them. You have to capture them. You have to capture them by various methods. I am not going into the methods, but you absorb those volatile poisonous materials in some kind of mechanism, and then the absorbed poisons are subjected to further analysis. Normally, you go for gas chromatography in case of volatile substances, normally, and that is very, very useful. These are the gases. Again, you need gas chromatography. Gas liquid chromatography, I have seen, is very, very useful in identifying this kind of poisons. In case of carbon monoxide, because it is difficult to now go to each poison, and there are poisons which are peculiar in nature. They give rise to some specific signs and symptoms. As somebody inhales carbon monoxide, then the carbon monoxide gets reacted with blood, and it gets reacted with hemoglobin mainly, and it forms carboxyhemoglobin. Now this carboxyhemoglobin is pink in color. So in case of carbon monoxide poison, the blood will become cherry red blood. So during postmortem, the doctor can identify the color of the blood, etc. And you'll find cherry red patches on the body because of the cherry red color of the blood. And if that is suspected by a doctor who performs postmortem, then there is a special method for taking the blood, preserving the blood. Normal procedure we will not allow. And then in this case, a toxicologist will analyze carboxyhemoglobin. And carboxyhemoglobin is a very, very unstable material. It is a very, very unstable derivative of hemoglobin. And that unstable, because the moment it comes into contact with air, it immediately gets converted into oxyhemoglobin again. So what is normally done? You put a layer of paraffin. So when you collect a blood, for example, there you put a layer of paraffin, and that paraffin will not allow air to react with your carboxyhemoglobin. So these are the precautions. This is how the toxicology goes. And then cases of poisoning, there are three types. Accidentally somebody takes poison, somebody takes it for homicidal purposes, or somebody wants to kill someone using poison. And this fellow will select a poison where it does not have a smell. Smallest quantity of the poison is sufficient to kill a person. And he will also try to see that this poison also is not detectable when it goes into the body. So they will not come to know that this fellow died of this kind of poisoning. And that is normally, we call it homicidal poisoning. And suicidal That doesn't. Normally people take insecticide, etc. But if you want a peaceful death, that also is there. In case of insecticide, you will have a lot of vomiting. There are some convulsions, etc. So that people don't enjoy this. And then in case of suicide, people go for barbiturate, diazepam combination, what is known as cocktail combination. After that, the person goes into deep sleep, gets converted into coma, and then ultimately the fellow dies. So they consider this as a peaceful or a painless death. So you have to keep these things in mind. That is a suicidal poisoning. These are the possibilities of poisons a person may take. Is a homicidal poisoning. These are the possibilities. Accidental poisoning. These are the possibilities. So you have to narrow down the possibilities of poison and then go to the classification and look for particular kind of poisons. Effect of poisons we already discussed. There are 4 modes. How can a poison enter into the body? Through ingestion, somebody can swallow. It can be given through injection. It can be taken also through injection. So injection is also a mode. And then absorption through skin, etc. When there are poisonous materials, where they come into your skin, contact with skin, and gets absorbed, and they start causing poisonous effects. They're very, very dangerous, very, very strong poisonous materials. You might have seen some of the vegetable poisons also. You just come in contact with the leaves of some poisonous plant, and it starts getting itching, etc. And then if you ignore the itching, ultimately they create all kinds of serious symptoms. And you need to treat this kind of people in a different manner. You can't ignore the treatment part. And then the last one is inhalation. You inhale these kind of, and they are normally poisonous gases. So you inhale these gases and then people can die. This kind of inhalation goes normally to the lungs, and inhalation also goes in the brain. So lungs and brain, these are the main organs where if you want to really know whether the fellow died of inhalation, so you have to take brain and you will look for lungs, and you will get these poisons from this. Otherwise, you will not get it from stomach, liver, kidney, and intestine. So that also you have to keep in mind what kind of poison it could be and what was the mode of inhalation. This information a toxicologist is supposed to keep. He has to have idea as to which are the modes of injection. If suppose there is an injection mark on the body, then immediately the doctor will say, yes, this fellow has taken this poison through injection. And then you need to collect different kind of material. Even in injection, you need to take out that skin portion, maybe blood is required. In that case also, stomach, liver, kidney, intestine, etc. may not be of much use. So this is also suspecting a poison, suspecting the mode of injection, administration. The doctor has to decide which is the most suitable organ or a material or a sample which will help toxicologist in determining its level and its type and its identification. It's very important. Again, the same thing. Actions we already discussed. I am not repeating this thing because I don't want to go into the much details of this. This also has been discussed. Action of poisons we have already discussed. Some of the antibodies is also there. Sources. These poisons, as I told, they are available in the market openly. Lakhs of poisons available throughout the world. Anywhere you go, you will find poison. Easily available. Some of them are available even at our home. So they are known as domestic poisons. And they could be detergents, disinfectants, cleaning agents, insecticides, rodenticides, antiseptics, even some of the medicines which are available in our home. Could be source of poison. Agricultural poisons, insecticides, fungicides, weed killers, etc. They are available in the place of farmers, available either in the farms or in the home of farmers. They normally keep it in their homes. They are also there. Industrial poisons, they are available in factories. Manufacturing is going on. So you have raw material which is poisonous in nature. You are manufacturing some drug which is also very, very sensitive and could be poisonous. So you are creating, manufacturing some compound. Say for example, methyl isocyanate is manufactured for different application. Now this methyl isocyanate is a very complicated and very, very sensitive poisonous material. Now this can cause, which happened in case of Bhopal tragedy, methyl isocyanate leaked and then everybody inhaled it. Large number of people died. Now this was manufactured by a company. It was manufactured in a factory. Some leakage, people will inhale this. So these are the poisons which are, the cause is industry or factory. They are commercially available also. Some of them are available in food and drinks. Drugs and medicines. Some of the drugs, very, very sensitive. Some of the drugs are banned. Now, and they are given under some restrictions. There are some laws. If these drugs are taken in some larger quantity, person may die. And miscellaneous sources, snake bites, etc. Natural, you can call it. Smoke, CV gas, etc. Normal symptoms, how to find out that the person is suffering from poisoning. If you have this kind of poisons, then you can suspect he has vomiting, he has diarrhea, he has cramps, delirium, etc. So if these kind of symptoms are mentioned by the family members, the person has died, the doctor who performs postmortem can suspect, yeah, the person had vomiting, it could be this kind of poison. The diarrhea, it could be this. So the doctor who performs autopsy will also have some idea as to, yeah, this poison could be like this. And when he opens the body, he will also look for the symptoms which are specific for that poison, which are seen in the dead body. So it becomes easy. As I told, it's a very, very complicated area. So you need total coordination at all the levels, even right from autopsy, even from history, knowing from the family members, etc. Diagnosis, as I told you, is now you can diagnose even from the external examination of the dead body. Just looking to the color of the skin. As I told you, carbon monoxide. Now cherry red. When you find this, you can suspect it could be only carbon dioxide or carbon monoxide. This is how. And some of the poisons, they create cyanosis. So cyanosis is, you will get the color of the lips where hemoglobin is refracted maximum. And normally when some patient is examined by a doctor, doctor will look at two places. The nails, condition of the nails, and the lips. This is the place where the blood color is seen maximum. So these two places you will find effect of cyanosis. And cyanosis is deprivation of oxygen. So now oxygen is deprived, so this blood is not able to get oxygen. Oxyhemoglobin, which is red in color, is not formed. And when oxyhemoglobin is not formed, this blood cannot remain red. It gets converted into a blue color. And that blue color is seen on nails and lips. So this we call cyanosis. So these are the symptoms of cyanosis. That also, while performing a postmortem, the doctor will come to know that this death is due to cyanosis. And cyanosis can be caused because of this category of poisons. And then what are the materials to be collected when you want to determine the cause of death? With viscera. Viscera means what? And then how to preserve them? what kind of preservatives are to be used. We have seen some cases long ago. Person was suspect to have died because of alcohol poisoning. He must have taken excess of alcohol. That also is poisonous, and it is said the fatal dose of absolute ethyl alcohol is 200 milliliter to 500 milliliter. So if somebody consumes 200 milliliter of ethyl alcohol, person can die. Now this was a case of alcohol poisoning, and unknowingly the doctor, without knowing the history, preserved the body materials in alcohol, because alcohol is a rectified spirit. We now use in Gujarat, because there is a prohibition, we use denatured spirit, but denatured spirit is only poison plus alcohol plus water. This was used. Now this material is used. Now you cannot determine whether the alcohol you are getting from the tissues is because of the preservative or is because the fellow consumed it. So you must know that you have to suspect that this is a case of alcohol poisoning. Now you cannot use alcohol as a preservative. So these are chlorohydrate, formaldehyde, ether, phosphorus. Alcohol prevents luminosity. So these are the things. Blood should be preserved in fluoride, oxalate, EDTA. Now if suppose you want to go for DNA fingerprinting, etc., is required for determining the identification of a body, etc., then you use DDTA. When you collect blood, fluoride is the anticoagulant and also good preservative for blood. So not normally sodium fluoride is used in a small quantity, which takes care of coagulation part of the blood and also preservation part. So blood can be preserved for a longer time and it will not get coagulated. So this is how you need to know, depending on the poison you suspect and the organs or the material you collected for determining the cause of death, for determining the type of poison which could be there in the body, the decision of preservative is also to be taken by the doctor. And initially, as I told, even which part to be collected. Say, for example, is a case of metallic poisons. Now, in metallic poisons, your stomach, liver, intestine may not be useful. Metal gets accumulated in the body parts which do not have water. So they are accumulated metals in hairs, in bones, in nails, etc. So you need these kind of materials to be collected. If you collect routinely stomach, intestine, etc., it will not come. So this is how is a very, very responsible job, very, very responsible. Responsibility of the doctor who performs postmortem and responsibility of the toxicologist who performs detailed analysis. Urine and clothes you don't require normally a preservative because they don't get destroyed. Collection of viscera, not very. This also is collection of it. Different directives we have given. Blood, etc. I already discussed. Now, in case there are two types now. Toxicology has got two different departments. Forensic toxicology. One forensic toxicology is where you are dealing with the dead bodies, and you are working for determining the cause of death, whether the cause of death is due to a poisonous material or not. That is one role of a toxicologist. The second role of toxicologist is somebody has consumed poison and the fellow has not died. Now this person is getting admitted in a hospital as a patient. Now this person needs to be treated and needs to be treated in connection with the kind of poison the fellow has consumed. Because when you want to save this person, you need to go for some kind of a medicine for treating that person. In some of the poison cases, even medicines are not working. You have to go for antidotes. So you need to give some antidotes. Say, for example, the old one was British anti-lucide, BAL. BAL was a general universal antidote which was used for most of the inorganic poisons, metals, etc. So if you are suspecting this, do this. So BAL will absorb all kinds of inorganic materials. so the patient can be saved. Likewise, the antidotes are available. Now, in case of a person who is admitted in a hospital, person is leaving. He may tell doctor he has unfortunately, accidentally, with an intention to commit suicide, has taken this poison. So it becomes easy for a doctor to treat that patient. Accordingly, the patient will be treated. In case of patients who get admitted in under coma, patient is not conscious at all, not able to tell anything that what kind of poison the person has consumed. Now, coma could be natural because of some disease, coma could be because of poison. So you need to determine whether this coma is because of poison or not, because you need to treat the patient. If you are going for treatment of a patient, looking it to as a neurological problem because of which the person has gone into coma, maybe person may not recover. Because unless and until that poison is taken care, person cannot recover. So you need to go for determination of poison and its level in the blood. For this, these are the only samples. You have to take blood, you take urine. If gastric lavage is possible, you may take this. If the person has vomited number of times because the poison has been consumed, you may collect even the vomit. And preservatives, as I said, urine, etc. doesn't require any preservative. But if you have collected blood, you may use sodium or potassium chloride. Now, the role of a toxicologist starts. This area of toxicology we call clinical toxicology. Here, the person has not died, person is living. And now this person is to be treated based on the findings of the toxicologist. So immediately, toxicologist will reach the hospital, collect these materials, immediately come back to the laboratory and will extract out poisons. Again, he doesn't know what poison could be. The person is in coma. There is some idea as to coma can be caused because of this kind of poisons. So there is some idea with him. Now he extracts the poison. Two groups, inorganic, organic. And then starts analysis. Here he is supposed to complete the analysis within a very, very short period of time. Half an hour, maximum 1 hour, because patient needs to be treated. So without wasting any time, whatever is the final method available, he applies. And then in case of organic poisons, what he does is he extracts the poison, 50% of the material he is using for determining the presence of organic material. He extracts, the extraction procedure, I am not going into the detail. Extraction is done, and now he is looking for organic poisons. Straight away, he will go for either LCMS or GCMS. If he is getting anything there, that yes, there is a case of phenobarbital here, GCMS will tell you. And then if phenobarbital comes, he will decide even the level of phenobarbital in blood and immediately contact the doctor. This patient has consumed large quantity of phenobarbital tablets. Now, toxicologist, if he is a good toxicologist, will also have a knowledge how to treat that kind of patient who is suffering from phenobarbital poisoning. And as I remember, it used to be dialysis. Then person has to be put on dialysis. That will only take care. No antidote will take care of either diazepam or a phenobarbital kind of poisoning. So you immediately put the patient on dialysis, and patients have saved. We have done large number of such cases where patient was in coma and we detected either phenobarbital or diazepam or some other drugs, and then patients were immediately treated and we could save their lives. So I give more weightage to this kind of toxicology, clinical toxicology, where you are really working for saving somebody's life who is suffering from this kind of poisoning because of either accident or maybe with an intention to commit suicide. They need to be saved. Then we go to next. submission of samples, etc. is fine. Everybody knows. So I know submission of samples, how much samples to be taken, how much to be submitted, etc. is fine. Preservation, you already said how much you have to take. Normally, if suppose it is an unknown case where you are not aware whether it is a case of poisoning or not, and whether really the cause of death is poisoning or not, you normally take intestine, kidney, spleen, blood, urine, stomach, etc. So these are the routine organs, and we call them viscera. These are taken. Quantity of this is also determined, and so according to this 30 gram of intestine, maybe 50 gram of this, 500 gram of liver, 1 kg of or 500 gram of stomach, etc. Everything is mentioned. 100 milliliter of blood. These are to be collected in case of you suspect that there could be a poisoning, but you don't have any idea as to what kind of poison it could be. So these are the normal things which a doctor will collect. Now, if it is strychnine kind of a poison, then you collect cardiac poison. Then in some cases, as I told, lungs are the best, brain is also there, spinal cord, bone, nails, hairs, etc. Depending on the type of poison, you determine as to what is. Now, one more thing which of course, not part of the presentation, but say for example, earlier there used to be the person died of burns. There were 3rd-degree burns and person died. Afterwards, the allegations came that it was a dead body which was subjected to burns. Actually, the person was given poison, and the death is because of the poison, but then the body was burnt. Now, these are the so now doctors, even if it is a clear-cut case of burning, is a clear-cut case of drowning, they don't give opinion. The cause of death is drowning or burning. They will, in a routine way, collect viscera and send it, because there could be some possibility of poison, and the person was subjected to drowning. Person was subjected to burns. So this is very important. So you can't ignore, even if they are very clear-cut symptoms of burns, but then it could be poisoning effect also. So then if it is coming out to be a poison, that this person was given this poison, and then you are finding burns, then it's a different case. It's not a suicidal case which is normally informed by the family member that this person died of burns, etc., and committed suicide. It could be a poison. That means it could be a case of homicide. These are the cases that are decided. And one more thing is also seen here, before I go further. There are two important words in postmortem. Antemortem findings and postmortem findings. So, antemortem finding is the finding where the person was alive. And postmortem finding is you find those symptoms and signs on dead body. Now, if suppose there are marks of burning, then you need to determine these are antemortem burns or postmortem burns. If these are postmortem burns, that means dead body was burnt. And if these are antemortem burns, when the person got the burns, the person was alive. So this is how you differentiate, and their symptoms are also different. If it is antemortem burns, you will find burning symptoms in a different manner. Signs are also different. The antemortem burns, signs are different. Just one example. If suppose antemortem burns, you get some blister formation because person is alive. So there is a fluid inside, and that fluid is also getting heated, and that fluid coming out of the body in a blister form. Secondly, when the person is live, when the person is burning, will consume a lot of smoke. So when you check the trachea of that fellow, you will find carbon particles. So when carbon particles are present, you can say these are antemortem ones. And third, I told in the beginning, the person also consumes or inhales carbon monoxide, which is a product of every burn. Any fire you take, it will definitely produce carbon monoxide. So the person inhales carbon monoxide. If the person is live, then you will find the cherry red color of blood. Then and if you detect carboxyhemoglobin, you can say that these are antemortem burns. There is a carboxyhemoglobin present, there are carbon particles in trachea, and there are blister formation when you handle the postmortem. That is decided. So antemortem burns when person was live. It could be accidental, it could be homicidal, and it could also be suicidal. In case of postmortem burns, it is 100% homicidal. This is how it is decided. So, a very important role of toxicologist. These are the preservatives normally I have already discussed. Some of the important poisons. This is normally used for homicidal kind of poisoning. Yeah, this is an important thing I would like to. Now, aluminum phosphide, zinc phosphide, rodenticide, very commonly available. Now, when it goes into the body, it creates phosgene gas. And that gas, when you perform postmortem, it is normally accumulated in the stomach. And if you find the stomach of this fellow becomes very, very bulky, that also is one of the symptoms that this fellow has died of this kind of poisoning. And when the stomach is opened and then viscera is preserved, during that process, you lose this gas. And anyway, small quantity of gas is present. And we are taken viscera, it is sealed and sent to toxicologist. When toxicologist opens the bottle, whatever remaining gas was there also goes out. And he doesn't know toxicologist that this fellow is suffering from or has died of phosphide poisoning, aluminum or zinc. So then we have made a practice. Any case, you don't know where the specific history is. Even if there is a history, when you open the bottle, you collect all poisonous gases which are coming out through an impregnated filter paper. So they all get collected on an impregnated paper, impregnated with different kind of materials, chemicals. So that material gets reacted, and that phosgene, if suppose it is there, gets reacted with mercury chloride paper. Now we use mercury chloride, and it forms mercury derivative. Now you detect mercury derivative of this, and you can say there was a presence of phosphine. So phosphine can be detected like this. Now, for example, even phosphine, there are no traces of phosphine when you open the bottle. Nothing was there. And it is a case of zinc phosphide, for example. Then you need to look for zinc. If you get large quantity of zinc, which is not a normal composition of a human body, is much more than what the human body should have, you can say it is all because of zinc phosphide, because I am getting large quantity of zinc in the body. This is how it is to be interpreted. Acids and alkalis, they are corrosive materials. So they corrode the stomach. And when you open this kind of bodies, you find a tremendous amount of corrosions everywhere. So you can say that this is because of the either alkali or acid poisoning. When you take out the viscera material, and then it is easy for a toxicologist to identify this kind of acids and alkalis. Throwing acid is also a problem. It's not a toxicology anyway, but then you are throwing some poisonous material, hazardous material, and then you need to identify. In order to disfigure somebody's face, is normally used on ladies in order to harass them, etc. So this has become a very serious offense. A very strict punishment has been imposed in various acts of this country You can't throw acid-like material on anybody's face. So just to disfigure the face. There also, you collect the material which was thrown and then you determine the presence of acid. And this is how this can be handled. These are the acids which are normally used in case of this. Then the other common poison is pesticide. So these kind of pesticides are there. Now in pesticide poisoning, I would like to give one example. As I told in the beginning, the definition of poison and a small quantity of poison. Now parathion is a very common pesticide which is used. Polydol is the brand name of this, largely used. Now, the fetal dose of this parathion is 25 milligram, if I remember correctly. That's 25 milligram. Now, this 25 milligram parathion the fellow took and the fellow died. Now, it is equally distributed in the body. Now, there is also some detoxification which takes place because the person doesn't die immediately. For example, after the consumption of parathion, he died after 2 hours. So during that process of 2 hours, there is also detoxification of parathion which is taking place in the body. So that also is a very complication and debatable thing in toxicology. When you determine the quantity of the poison which is available in tissues, is it that quantity which is you are determining which is responsible for causing death, or this is the quantity you are determining which is left behind after the material was used for detoxification? And also argument is there that the material which is exactly used for detoxification is a material which is acting on different organs, and that is a material which is damaging the organ and is responsible for causing death. And what we are determining is excess material. That also is an argument. It is a debatable thing, but these are actually, if you speak, these are the challenges the toxicologists are facing. These are challenges. But anyway, you decide the quantity of the material which is present. Now this parathion, now this 1 kg of viscera you are getting will have half of milligram, that is 500 microgram of parathion. That parathion also gets detoxified, and the best metabolite which is present, and any metabolite you check, the best I like is paranitrophenol. Now this paranitrophenol remains in the body. Further detoxification is possible, but not that fast. After the death takes place, that further detoxification also doesn't take place much. Now you can determine the presence of paranitrophenol. If it is there, you can say that the person has died of parathion. You can also quantify paranitrophenol, and you can accordingly quantify and calculate how much parathion the person must have taken. And then you can decide that dose. So this is how a back calculation of this. In insecticides, you have organophosphorus, you have carbamates, you have organochlorine, pyrethroids. I'm not going into the details of it, but these are the compounds which are routinely available. Identification of this compound, identification normally is done using chromatographic methods. There are no other methods which are suitable. Traces of these compounds can be handled using chromatographic methods. Their extraction is also not that easy. You need to, normally the extraction is, they are neutral poisons basically. So neutral poisons, you extract them using hexane. Hexane, put the visceral material in hexane overnight, and then next day you decant it, filter it, and then remove the fatty materials which also got absorbed or dissolved in hexane, and then subject this kind of a purified material. to chromatographic analysis. And if you find some kind of organophosphate, carbamide, there are different materials which are, different chemicals which are used. Say, for example, normally these are the poisons which are detected using thin layer chromatography, because you have different reacting materials, reactants. They give different colors. Organophosphorus will give different colors. Carbamates will give different colors with different chemicals. Organochloride with different colors. I still remember organochloride, if it is you are suspecting, use silver nitrate spray, and then they form silver complex. This is how it is done. So then you go further for determination of quantity using GCMS, maybe GC, UV, etc. HCN. It is said in the history of toxicology that this is the most sensitive and most deadly poison. Few milligrams of cyanide is required to kill someone. And this is used many a times in homicidal poisoning cases, sometimes suicide. Detection of cyanide is also complicated. It forms hydrocyanic acid. And then hydrocyanic acid, when you open the bottle, comes out unless you capture it. So you need to capture it. And then captured filter paper where you captured hydrocyanic acid is subjected to various tests. Here also you can use silver nitrate or silver chloride. Silver nitrate is more suitable, paper impregnated, and then it forms silver complex, silver cyanide, etc. People also use lead impregnated paper, lead salt. Here, it also affects the blood. And then cyanmethemoglobin is a compound which is formed when hydrocyanide is the cause of death. And there is a different color. And then this blood, the presence of cyanmethemoglobin can be determined using ultraviolet spectroscopy. Excellent lambda maximum you get if it is a cyanoid complex of hemoglobin. Very, very important extraction. You don't know what kind of poison. You don't want to lose anything. So you need to extract volatile poison through steam distillation. Some portion of tissues, etc. you can take. They have to be divided into 3-4 portions, subjected to steam distillation. And then you check the volatile poisons if they are there. And remaining portion after steam distillation, the residual material, you can use for non-volatile organic, inorganic compound, both. Star-Soto is a very old method where alcohol used to be used. We used to use alcohol, ethyl alcohol, and then extract it, again evaporate alcohol, again. But then using alcohol is becoming very expensive. So now we have switched over to ammonium sulfate method. There is no alcohol used. You instead use ammonium sulfate. And some digestion also is done, some heating is also done, and then extraction is done. Now here, ammonium sulfate method, even Star-Soto, now you are looking for organic material, and then organic material could be of two types, either acidic or alkaline. In acidic, you get barbiturates, phenol, etc. In alkaline, you get all kind of alkaloids. So they are then divided. After you extract out ammonium sulfate extracted material, you even filtered it. That liquid, you acidify and extract with chloroform. You will get all kinds of acidic poisons. You made it alkaline, maybe using ammonium nitrate or sodium hydroxide, ammonium hydroxide or sodium hydroxide. And then it is alkaline, and then again extracted with chloroform. You will get alkaloids there. And then remaining portion, you can subject it to hexane method, extraction through hexane. There you get your insecticide as a neutral poison. But it is also said that your acidic portion also contains insecticides. So when you check acidic poison, the content of acidic, The neutral poison should also be checked along with acidic compounds. And then you also don't want to lose inorganic compounds, mainly the metals. So Rhines test is also required to be performed for some other small portion of your visceral material. So you're covering almost all kinds of poisons. These are the methods for, as I told in the beginning, very, very complicated is the job of a toxicologist. He has to come out with proper qualitative methods which are very, very sensitive, where you don't require big quantities of material. Small microgram quantity, even less than a microgram. This kind of quantity, even if it is there, these methods are sufficient enough to detect them. So without wasting much time, organic materials need to be examined through this. And inductive coupled plasma with mass spectrometry, you can apply for all kinds of your inorganic materials. That also is there. So this is how you need to select the method depending on the kind of your poison you have extracted out. Some information you must tell that it belongs to a neutral group, it belongs to acidic group, it belongs to alkaline group, and accordingly you have to decide the column, you have to decide the flow rate of, and even the carrier gas, everything. You decide if it is a high performance liquid chromatography, your liquid phase, etc., is to be determined based on whether the material is acidic or it is alkaline. So then everything is to be decided in a different case-to-case basis. No single method will help you that you use methyl alcohol water combination and you utilize all kinds of your poisons. No, if it is acidic, different liquid is to be used. If it is alkaline, different liquid is to be used. This is how you have to decide. And then ultimately, if you are detecting something and you need to identify without wasting more time, you straight away go for mass spectrometry, and that will give you identification. Very, very sensitive, and most of the toxicologists throughout the world are using either GCMS or LCMS method for determining the identity of a poisonous substance. And many times, even if you have done everything accurately, right from taking the tissues with a weight, etc., extraction, etc., then you can also say that this 25 gram of these tissues, they are containing this many milligram of the substance. So some way of, you can call it a semi-quantitative kind of analysis you can do using this methodology. I think we could finish. Yes, it is not a more time I have taken. I tried to cover everything with in a very limited time. And it is open to questions.
We are having some important questions.
Okay.
Thank you so much, sir. We are really privileged with your time and sharing the expertise in the field of toxicology. I believe that participants will surely be benefited with the information
that you have provided during our presentations.
we are going to take few questions, few important questions. As the first question was asked, what are the different actions of poison in the body?
As already I have discussed, different actions depending on the poison. If it is a acid and alkali, there is a corollary effect. If they have taken opium, etc., the effect is different. The fellow will have constipation, there will be fever, there will be some kind of fluctuation in the blood pressure. In some cases, it will be diarrhea. There are some cases there will be vomiting. Everything I have mentioned. So there are a list of symptoms you get depending on different kinds of classified poisons.
So, question: what are the ways by which we can decrease the amount of absorbed poison? What are the ways by which we can decrease the absorption?
You have to use antidote. That's how antidote is only. Say, for example, BAL, British anti-leucite. That is a very common antidote. Now, this BAL is capable of absorbing your excess poison. So it will not allow this poison to get absorbed in the body. On the contrary, ball will absorb this poison.
So next question, what is the correlation between the length of time of decomposition and the amount of the analyte that can be detected from that decomposed material?
It depends on many things. The body condition, whether it's acidic or, and then how long the person survived after taking poison. So if the fellow has survived for 6 hours, 8 hours, 10 hours, then this detoxification, hydrolysis, decomposition also takes place in a much faster rate. So you cannot determine that this is the rate where decomposition will be only this much. You have to take into consideration the period, how long this fellow survived after consuming a poison. If somebody has died immediately after taking a poison, then you have to check in vitro, in vivo, what is the decomposition rate. The person is alive, what is the decomposition rate? If the person is dead, then what is the decomposition in a dead condition? And then according, and every poison has got a different rate of decomposition and hydrolysis.
So last question, is there any treatment for people who blindness caused by methanol toxicity?
Yeah, we give alcohol, ethyl alcohol. Ethyl alcohol is the best antidote for methyl alcohol poisoning, because people don't die because of alcohol, either ethyl or methyl. Methyl is not the cause of death. The cause of death is formaldehyde. So when methyl alcohol gets converted into formaldehyde, formaldehyde immediately affects the retina, so the fellow goes blind, and then this formaldehyde damages other systems, and then the death takes place. Now, ethyl alcohol is the elder brother of methyl alcohol. So when ethyl alcohol is present in the body, being an elder brother will say, no, I will not allow you to sacrifice. You can't get converted into formaldehyde. It is my turn. I will get converted into acetaldehyde, acetic acid, carbon dioxide, and water. Till my total detoxification is made, you cannot get converted. So you remain like this. So more alcohol you give, it will not allow methyl alcohol to get metabolized into formaldehyde. So you will get as such methyl alcohol, and that gets excreted in as such form from urine. So this fellow excretion of methyl alcohol through urine, slowly, and go on giving him ethyl alcohol. So there is, so long you don't allow methyl alcohol to get metabolized into formaldehyde, there is no problem, because methyl alcohol is not poisonous.
That's it, sir. Thank you so much.
Thank you. Thank you so much.
Done with all questions, sir.
Thank you.
Thank you, sir.
Thank you.
Thank you.
So we are completing our session. Thank you one and all. And we are really thankful to everyone and the authorities of the university to allow for this webinar. Thank you.
बंद कर दो.
Yes, sir.
सर मास्क ले लीजिए आपका मास्क.
कैसा